Respiratory diseases, common cold, a runny nose and sore throat are among the first symptoms that appear when infected, followed by frequent coughing and sneezing. Other symptoms include headache and fatigue. Colds usually occur in the winter and spring seasons, but a person can be infected at any time of the year. Symptoms last from 7 to 10 days. In most cases, a person may be infected 2 to 3 times a year, while children may be exposed to a number of infections more than 3 times a year. There is no effective vaccine against the common cold, so protect yourself and others from infection. Washing and sterilizing hands, avoiding contact with infected people, and not touching the face, mouth, and eyes are among the most important preventive requirements. Viruses that cause cold symptoms in children are numerous, and the most common are, first, rhinovirus. It is considered the most common, and this virus usually spreads in the spring and fall. Second, para-influenza, a virus that causes symptoms very similar to the symptoms of influenza, and there are 4 types of this virus, one of which spreads at the beginning of the summer and also around the year. Third, respiratory syncytial virus RSV. This virus usually affects younger children and may cause symptoms of similar to asthma and may require hospitalization, and is present in most months of the year, but globally the increase is in the autumn. There is no cure for colds, but analgesic and antipyretic drugs are taken after consulting a doctor. How do we differentiate between common cold and seasonal influenza? Symptoms of the common cold and seasonal flu are similar, and it may be difficult to differentiate between them. However, the symptoms of influenza may appear more severe and are characterized by a high fever in addition to severe fatigue and muscle pain. The complications of seasonal influenza are the most dangerous, especially among the elderly, children, and those who suffer from chronic diseases. How to protect yourself and others from infectious respiratory diseases. Make sure to wash hands frequently and teach children, especially school students, to wash and sanitize hands. Isolate yourself, avoid contact with infected people, and make sure not to go to school or work when symptoms appear. Avoid taking antibiotics without consulting your doctor. Be sure to get the seasonal flu vaccinations. There are symptoms that you should pay attention to, and be sure to seek health care as soon as possible. If respiratory symptoms persist for more than 10 days. If there is a very high temperature or severe symptoms. If the child is 3 months old or younger and has a high fever or lack of activity.